I rise today to speak to Bill S-233, an act to amend the criminal code, assaults against persons who provide health services and first responders. As Senators Housakos and Youssef have pointed out, the bill is relatively straightforward. It would require judges upon sentencing to consider an assault of a health worker, health service provider, paramedic, firefighter, or other first responder in the course of their duties as an aggravating circumstance. The original version of this original bill, which was then known as C-321, focused specifically on health professionals. But the version that arrived at the Senate, which has now been represented by Senator Housakos, has been expanded to include all those who deliver personal care services. So it could now encompass people such as healthcare aides who are providing home health care to seniors, live-in caregivers or nannies who are often trapped in conditions of employment that make it difficult for them to escape from abuse, registered massage therapists who might be at risk of sexual assault by clients, and medical staff at abortion clinics who risk being assaulted by anti-abortion activists. If we are indeed not going to hear from witnesses on Bill S-233, with Senator Tanis's words ringing in my ears, I do want us to know that there is still room for debate and discussion about aspects of this bill. Because when we were in meetings last year at the Standing Senate Committee on Legal and Constitutional Affairs, we heard some truly disturbing testimony from witnesses about the increasing frequency and increasing violence of attacks on health workers and first responders, a situation that has gotten much worse, we were told, in the wake of the COVID-19 pandemic and in parallel with the rising problems of fentanyl addiction and large homeless encampments. Although the evidence we heard was largely anecdotal, there seems little doubt that the problem is real and intense. According to testimony from the BC Nurses Union, 39% of their members report being exposed to weapons on a monthly basis. Half of them report experiencing physical violence at least once a month. A staggering 99% of respondents in British Columbia said they experienced reportable incidents, in other words, assaults and threats that technically rose to the level that they could have been reported to their employers. And yet, more than half of the nurses surveyed said they did not report anything to their employer because they lacked faith that anything would be done about it. And here we come to the complications and conundrums within Bill S-233. The new sentencing provisions in this legislation only have force and effect once people are arrested, charged, and convicted. This bill in no way protects nurses or health aides who are so frequently assaulted by patients with dementia. Nor does it protect paramedics and firefighters dealing with people in the grips of drug-induced psychosis or a manic episode. If a patient or client lacks mens rea, if they can't form criminal intent, they are unlikely to be charged or prosecuted. And in such cases, the assurances offered by Bill S-233 cannot act as a deterrent or a protection. They can't safeguard vulnerable health workers or first-line responders in any way. These new sentencing protocols could certainly be applied to, say, a violent husband who assaulted a paramedic trying to care for his injured wife, or to a frustrated patient stuck in a hospital waiting room who attacked a triage nurse. Although even then, you'd have to assume that someone lashing out in anger in one of the worst moments of their lives might not be considering the deterrent effects of a criminal code amendment. But Bill S-233 would be of no help in the case of a man with Alzheimer's who groped a health aide, or someone being roused from a fentanyl toxicity by a shot of Narcan who lashed out blindly at their rescuer. Tweaking the criminal code feels like we're doing something, but after listening to all the testimony at committee, I fear it is more of a gesture than a solution for the crisis in our healthcare system. Some of the most powerful testimony we heard at committee came from Erin Aris, a registered nurse and then the president of the Ontario Nurses Association. Let me quote from her testimony. Quote, "As nurses and healthcare workers, we are subject to violence and abuse every single day, and it is on the rise," she told us. "We provide care when someone is in crisis, yet the existing measures in place do not take care of us. We are the front lines in hospitals, nursing homes, clinics, and in our communities. When we work in teams, we are most often understaffed. When we work alone, such as in home care, there is no one else around, no one to call when a situation becomes unsafe. As nurses, we are assaulted, pushed, spat on, sworn at, and experience intentional needle stick injuries. I worked on the front line as a nurse in an emergency department for 20 years, and while I worked at the bedside, I've been assaulted too many times to mention. I've had my hand broken by a patient. I've been threatened with a gun, a machete, box cutters, knives, and assaulted with the equipment we use to provide care. I was even kicked in the abdomen when I was 8 months pregnant with my son." End quote. Her testimony came as a metaphorical gut punch to us, too. So I asked her, were any of the attacks that she personally endured ever investigated? Was anyone ever charged or convicted? I think her answer surprised many of us around the table. No, she said. There had never been a single charge laid. When she was a young nurse, she told us, a patient said to her, quote, "I will kill you and your 2 beautiful children, who I notice are out in the car waiting for you after your shifts every day." I tried to report that, she told us, but nothing was done. Senator Prosper then asked her to explain why that was the case. And she described working in a culture that taught nurses to downplay their injuries and to expect no support from their managers. A working culture where they were pressured not to report assaults, but to accept them as a routine part of the job on pain of being fired. Quote, "If we don't care for our patients or residents or clients, depending on the setting, that could be considered patient abandonment and could result in a suspension of our license to practice," she testified. That is always hanging over our head, and we are taught, it is pervasive within the healthcare system, but also in school, that you put yourself second, that you care for your patient no matter what. The other thing that you will find across all sectors of healthcare, and particularly for nurses, she continued, is that if you are assaulted or subjected to violence, quite often you are blamed for the violence or the assault, and that it was a delay in care or it was something that you missed, and therefore it was your fault as a nurse. We heard disturbingly similar testimony from Paul Hills, the president of the Saskatoon Paramedic Association, who is here with us today. Let me quote from Mr. Hills. "In Saskatoon alone, we've had ambulance windows smashed while paramedics were attending to patients inside. Medics have been attacked with weapons. This year, an ambulance was stolen with 2 medics working inside on patients. One person was tossed around inside the vehicle, and both medics sustained injuries resulting in time away from work," he testified. Then he added, "I have had my life and my family's lives threatened too many times to count. I don't have the ability to have anonymity in my job. Any person can find out which attendant was at their call. I'm in the phone book. I'm down the street. And gang members, rival gang members, they can find me. They track me from work. They know where my family lives and where my kids go to school." That's the kind of thing that really hits home when you get told in the back of your ambulance. We've had bats, machetes, and knives pulled on us and removed guns from patients, all while trying to provide care. But just as with the nurses, Mr. Hills said there is little or no legal support, much less protection, for paramedics who experience assaults on the job. We don't often report these things, he told us. We do, and have come to the point where some of this is supposedly part of our job, because there have been situations where we've been turned away by the legal side, by Crown prosecutors saying, "It's part of your job. You getting pushed down the stairs, it's not really a big deal." He went on to explain that paramedics and firefighters exist in a male-dominated space, a macho space, where they are conditioned to never show emotions and never ask for help, where they are taught not to complain or look like victims. And this is the central challenge presented by this legislation. It will not work if complaints are not filed and if charges are not laid. At committee, we heard again and again about toxic cultures of silence, a culture of stoicism, which discourages health workers and first responders from pressing charges, and about a culture of neglect, which discourages police from investigating these complaints and discourages Crown prosecutors from laying charges. Worse than that, we heard heartbreaking testimony about the failure of healthcare managers and first responder organizations to protect their workers from being assaulted in the first place. Even at its best, S-233 could only enhance punishment after the fact. And it became more and more obvious, as we heard from more and more witnesses, that we need to be far more proactive. We must find better ways of protecting vulnerable workers from being attacked at all. We can't just shrug our shoulders and write off assaults as part of the job. We can't expect our health workers and first responders to accept violence as a commonplace cost of doing business. Bill S-233 may accomplish something. by underlining our national denunciation of violence against the very people who are sacrificing so much to protect and care for us. It can send a message that we, as Canadians, will not tolerate these repeated attacks on some of the most heroic and essential members of our community. But then we have to back that legal and political symbolism with concrete political action. We need our healthcare system to protect and defend workers on the job. We need our paramedics and firefighters to be safe on the street. And we need to break down the walls of silence that prevent people from reporting violence and dismantle workplace cultures that normalize violence as part of the job. We need to do that, not just to protect individual workers on the front lines, but to make sure that we still have people willing to serve as nurses and health aides and paramedics and firefighters next year, in 10 years, and long after that. Otherwise, we will have just added a line to the criminal code to soothe our consciences. I want to end these remarks by thanking all the brave witnesses who testified for their blunt and powerful testimony. I want to thank every single Canadian healthcare worker and first responder for their service to their patients, their communities, and our nation. And I personally want to thank especially the nurses, the healthcare aides, and the paramedics who have done so much to care for members of my own family in their times of medical crisis. In those times of stress and fear and grief, I probably did not take the time to thank you enough. But bless you for all that you do. May you be safe and stay safe, and may you have the respect you deserve as you continue your vital, valued work. Merci and hi-hi.